So the basic problem with FCS is that the chylomicrons, which are these big lipoproteins that basically carry the fat that we eat and are made by our intestines and then put into the bloodstream, these chylomicrons are not broken down effectively. The enzyme that's required for breaking down the fats in the chylomicrons, called lipoprotein lipase, is basically missing in patients with FCS. So there's no ability to break down the triglycerides efficiently. And so one approach to treating, to trying to manage the condition anyway, is to limit the amount of fat that comes into the chylomicrons, which basically is limiting fat in the diet. So we really try hard to work with these patients to get them to limit the amount of fat they eat, reducing the amount of chylomicrons that the intestine makes, and therefore reducing the triglyceride levels in the blood. There's been a lot in the news over the last several years about carbohydrates and triglycerides, and the fact that our high carbohydrate dietary intake in the United States and Europe contributes to high triglycerides and, of course, obesity and other complications. And in fact, many physicians have heard this so much that they assume that the way to treat high triglycerides is to limit carbohydrate in the diet. And while that's true maybe for certain types of people with high triglycerides, particularly when the triglycerides are coming from the liver, it's really not the way to treat patients with FCS. So the patients with the very high levels of triglycerides, over 500, in fact, many times over 1,000, really it's coming from the intestine. It's really a reduction in dietary fat that is the appropriate treatment for lowering triglycerides as best we can in patients with this condition, and not a limitation in carbohydrate per se.